Hi, everyone.
Hey, Don.
It is long term, yeah, I mean, they should get them out of it.
Wait a couple more minutes and we'll get started.
Hello, it's Bill Fisher. I'm just signing in.
Bill.
It's actually incredibly fun.
Oh, is it? Okay.
Yeah.
Then that'll make it feel better.
Yeah,
What are they gonna do?
yeah, they'll sit there and talk. Yeah,
Is it kind of like what Ricky said?
Recording in progress.
yes, I think so.
Hey, Don,
Hey, Sam.
how are you?
Good, how are you?
Good.
I guess I'm the only guy with video today. Hey, guys, put your pictures up. We can see you. Hi, Sam.
Always said that all my interns, the least invasive, most appropriate treatment.
Mike sent me a text that he probably is not going to make this meeting or the next meeting. Hello, Jay. All right, guys, why don't we get started? This is sort of going to be a combined meeting. As Tim more or less sent out, we have Jennifer, who's going to be joining us at 2:30 to give a talk on behavioral health. This meeting will be done well before that, I assume, but we don't have that much to discuss. Can we have a review and approval of the previous meeting minutes? Anybody?
Motion.
Thanks, Rob.
Second.
I'm not sure who that was.
Bill Fisher.
Oh, thanks, Bill. You're kind of windy there. Must be in and out inside. Anybody opposed? Okay, meetings minutes are accepted. Old business, just give you guys an update. Myself and the SEMSCO chair, Philippi, had a meeting with the health commissioner. It was a Zoom meeting, but still very productive. She seems to be very nice, seems to be interested in EMS. Was interested in having a statewide medical director. So we're putting together a job description at her request that we'll bring to CMAC and SEMSCO for approval, and then we'll get it off to her. Likelihood that won't happen at this coming meeting. It probably worked on it this coming meeting and then brought for a vote the following meeting. But at least we're moving forward with that. And that will be very helpful because Greg Young, who has sort of filled that role unofficially, is retiring from the health department. He's been there for about 30 years. So that is who DOH has been using when they need to ask specific EMS questions when CMAC and SEMSCO is not in session. And he will be leaving, so we'll get somebody in that position. New business. Any other old business anybody has to mention? Okay. New business. Agitated patient protocol has been going back and forth by email. Tim, I don't think anybody on the committee has gotten this. Is that correct? Unless they were.
What is that, Don?
The agitated behavioral emergency agitated patient protocol.
Negative. I don't even think I received it yet.
Oh, okay. Well, then I guess we'll have to put it out at the next meeting. Basically, it just sort of tightens up the protocol that's out there now. Really not that much of a change. Initially talking about Versed and then potentially ketamine if needed. But we'll try and get that out before the next meeting so everybody has that. Any other new business anybody wants to bring up? Okay, it's going to be a very quick meeting, I guess. Courses and courses that are coming up. Tim, you have any courses? Hey, Tim? Okay, well, let's move on then to Jonathan. Anything from Cobleskill?
Nothing new from Cobleskill, just that we're just about halfway through the second semester for the paramedics, as well as an EMT and original and refresher. And we plan on holding paramedic course and an EMT original and refresher in the fall. We're also going to be running a rapid research for paramedics and AEMTs. I believe those are in July. When I have more information, I can send that out to everybody here about it.
Thanks, Jonathan. Bob, anything new from Hudson Valley?
So we are gearing up for our summer EMT course, the original and research. That'll be starting the 23rd of May. We also have a paramedic research starting the beginning of May. And again, our two EMT originals in the fall and our two paramedic originals in the fall are in the works.
Okay, thanks, Bob.
Hey, Don, it's Tim. Can you hear me now?
Yep, I can hear you. Go ahead.
I lost the connection for a second there. The only thing we have on our slate as far as Remo is concerned is a full certified lab instructor course. Folks can register via the website. It's going to be 3 days, May 2nd, May 4th, and May 9th. We're currently working on planning our spring, summer EMT course slate, but nothing yet.
Okay. All right. Anybody else have anything else to add to that? Courses?
Don, it's Deb.
Hey, Deb, what's up?
Just to add to that CLI course, there are 3 in-phase sessions followed by submission of a video plus critique. So there is a 4th session, but it's not face-to-face.
Okay. All right. Anybody else have anything else to add? Any items from the floor that anybody wants to bring up? Okay, only news that I can also bring up is Suffolk County has been looking at potentially joining the collaborative protocol, so that would be great. That would, that's almost the entire state. More discussion on that later. All right, well, if nobody has anything else, then I guess I'll give you back the next 24 minutes until we have our mental health discussion.
Actually, let me look.
Jen's on the call.
40.
Is Jen on the call? Well, if we can, well, then we can just get started and get be done early.
Okay, yeah.
I am on the call. Wasn't sure if I joined too early, sorry.
No, no problem, Jen. So why don't we close the academic committee meeting, and Rob, you can start the other meeting, and then we'll just go that way. Does that seem appropriate?
Okay, so why don't we just lead off with Janice, like from
Northern Rivers.
yeah, normal mobile crisis. We're forgetting which is, so you can go ahead and take off.
Okay, so hi, I'm Jennifer Eslick. I'm the Executive Program Director for Crisis Services at Northern Rivers, otherwise known as Parsons or Northeast, depending on whether you work in Schenectady or Albany, but they merged to become Northern Rivers. We run the 6-county mobile crisis service, which covers Saratoga, Warren, Washington, Rensselaer, Schenectady, and Albany. We only provide crisis response to youth in Albany. We do adults and youth in the other 5 counties. The reason why we only cover youth in Albany is because we share the county with the Albany Mobile Crisis Team, and now also the Accord that covers the hill towns. So sometimes Accord might be out on a call with you, but sometimes it could be us, depending on the timing of the call. I'm still working through some of that with the county because we've always covered the youth in Albany County solely, but with trying to get Accord up and running.
Vera, stop it. STOPIT.
All right, mute.
Someone just, I don't know who that was. Someone just.
So just we're covering Albany County for kids and the other counties, adults and kids, but we work closely with the Accord and Albany Mobile Crisis for the city and other areas of Albany. Wanted to just have an opportunity to speak to you all to let you know, in case you get on a call that we're out on, or just our involvement with law enforcement, but also obviously mental health calls in the area. We actually try to go to our calls without law enforcement. We go in teams of 2. We do a very thorough screening. And if we can go to the call without law enforcement, then we do. If we need to go with law enforcement, then of course we ask them to come with us. Many times we're out on calls with law enforcement because they've called us. Specifically in Schenectady County at the moment, we're actually built into the 911 system. So it's a kind of a 2-part path. If somebody calls 911 and there's not any imminent or acute safety concerns, but it's a EDP call, they will actually transfer that individual to us and let us just manage it to prevent law enforcement or other emergency services having to respond. And the other side is that if law enforcement is being sent to an EDP call, they request us to meet them there on site. Starting to work through that in Rensselaer County as well. We're just not official in dispatch, but we've been working closely with Troy and the Saratoga Sheriff and all over Rensselaer County. We also work closely with the law enforcement in our other counties. We're just not built into their 911 systems yet. But just a little bit of information about us is our kids team has really been around for about 17 years. They've covered Albany, Schenectady, and Rensselaer. Not a lot of folks knew about us because you had to access us through like CDPC or Samaritan or Ellis. About 4 years ago in 2018, when I came to mobile, we went to our own dispatch system. So folks can call us directly to either get phone support, almost like a suicide hotline, or again, we do assessments or support over the phone, or we go on site to actually do the assessments. We really do anything from the suicidal individual to the homicidal individual, somebody that's just experiencing anxiety or depression, psychotic, features, agitation and aggression, and then just emotional and behavioral disturbances. We will go out even if there's a young child that won't get on the bus because of school anxiety. If there is an agitated individual in the community, we encourage other emergency services, including law enforcement, to utilize us so that we can be there to support you all, but also the client. And hopefully then, there's no hands-on and nobody has to get hurt. So we really ask definitely law enforcement to include us on those when they get called to those. But again, there's also just individuals out there that don't necessarily have suicidal or homicidal, might just be depressed or anxious. And we can either manage that over the phone, or sometimes we have to go out on site to do that safety assessment. Our teams are made up of licensed clinicians. So that's either LMSWs, LCSWs, or mental health counselors, licensed mental health counselors. We also have peer specialists, which are individuals that have lived experience with mental health. And we also have family advocates, which are parents raising or have raised kids with or family members with mental health or disabilities. And so a lot of times our teams, we kind of send folks out based on obviously our staffing, but also who's available. If it's a youth call, then we will try to take a clinician and the family advocate so we can provide that support to the family as well. Or if it's an adult call, the peer specialist will go out with us. Sometimes it ends up being 2 clinicians. We are state and county funded. However, in April of last year, we were able to start billing Medicaid. We're a free service to anybody in our counties, whether you have insurance or have any insurance. It's just that with the Medicaid, for folks that are Medicaid recipients, we were able to start billing for Medicaid to increase our funding to try to expand, because right now we are only Monday through Friday, 7 a.m. to 11 p.m. and Saturday and Sunday, 11 a.m. to 7 p.m. I did send Tim our flyers so that he can get it out to everybody. So you don't have to write down our hours if you are trying to do that right now, but we are not 24/7 yet. We were supposed to be, but COVID hit and then we lost state and county funding and we're not up in Medicaid billable yet. However, our goal is by November, end of year, as long as workforce crisis does not continue to crush the world and also COVID stays away, or at least stays at bay the way it is. That's really the challenges we've had about going 24/7 is because of funding deficits as well as decrease in staffing. Lost a lot of my staff during COVID because they did not want to go into homes. We did not stop going into homes when COVID hit. We obviously tried to triage and telephonic what we could, but we felt we were the behavioral health of emergency services. So we still went out for individuals that we wanted to prevent from going to the hospital or prevent law enforcement or any other emergency service to get called to. Really trying to get individuals in the community to call us first and not 911, which is why it's everybody's, kind of a joint effort to get individuals to call us and not 911. Everybody loves to call 911, and you all know that better than anybody. So really trying to partner together on, whether you just make sure you have our information and you get it out to individuals you go out to in the community. Like law enforcement, we have magnets that we've had them put in their patrol cars and they're handing them out. And so individuals are starting to call us. And then again, just calling us when you are called to a call that might have some type of behavioral health or EDP component to support you all, but also the individual. Our program is geared to deter from the hospital. We actually do the same assessment in the community that is done at the hospital. We actually probably do a little bit more of a lengthier assessment that sometimes is done in crisis units or ERs. And we also always do next day follow-up. And we can even, now that we can Medicaid bill, we can follow individuals up to 14 days in case they need to be connected to treatment or we're concerned that they're going to not come out of crisis. We, like I said, do a very thorough mental health assessment. We look for current life stressors, mental health problems and symptoms and history, their protective factors, cultural considerations, support network, their risk factors, current functioning. Obviously, the mental status exam on, how they're presenting, because what they're saying might be different than how they're presenting. But then obviously risk assessment if there is concern for safety. There are many individuals in the community that live with suicidality every day, and that does not mean they need to go to the hospital. Too many folks are actually being brought to the hospital and then they're just sitting for hours and hours and either not getting an appropriate assessment or sitting there, and by the time they've sat there for 3-4 hours, they're no longer suicidal. And so now it's wasted the ER's time, EMS that's brought, fire, and all those emergency services and taxing Medicaid or insurance companies when there's a resource in the community that could actually do that assessment on site. So New York State has actually started an initiative. They've got a 3-year plan. I think it's going to take a little bit longer than that, but they have a 3-year plan to actually get every county in New York State with crisis services and be 24/7. They actually came to us in the fall to kind of learn how we've been functioning and how we've been working across the 6 counties, so they could kind of bring that back to help new programs grow and or open. We, like I said, are licensed clinicians. We're not going to purposely leave anybody in the community that we have concerns for safety, but we also do it every day, all day long, and know really what needs to go to the hospital and what doesn't. There's even individuals that we send to the hospital that actually get discharged within hours of us sending them. Because somebody that might say they're suicidal or call 911 when they're suicidal, that's sometimes a very fleeting thought. And by the time they get to the hospital, they've changed their mind. So again, we do that assessment. We work with them on getting them connected to treatment. And we also provide that follow-up the next day. Our 2 avenues are safety plan or send to the hospital. We now have the 958, which some of you may be familiar with, but there's always been a 958 pickup order for mobile crisis teams. So sometimes EMS or ambulance services might be being asked to transport under a 958. That is the same as a 941, a 960, a 945. They're all under the CPEP. However, there was never a form. And so we recently were able to get the state to provide us one. And so now we have that ability to not hold up other services waiting on scene while we're waiting for a pickup order from the hospital. We can actually do the pickup order on site to make it a much quicker bring to the hospital if necessary. Our call volume, just to give you an idea of what our call volume looks like, we, like I said, started taking our own calls in 2018. And our first year, we were just about 3,500 calls. And We, last year, from June to June, because that's when we started was June, we were just under, just about 6,000 calls, and we're already this year looking at probably being between 7,000 and 8,000 calls. So I know that the community is being made aware of us and utilizing us. And, we really encourage all of us to kind of partner together. We do trainings. We go and do trainings for law enforcement, and that's how this conversation got started. Is I know Dr. Daly very well from the Albany Med. I've worked at Albany Med for 15 years myself. I worked 10 years on the inpatient unit on E2 for 10 years as a supervising social worker before coming to Mobile. And then I still work in the ER at Albany Med. So probably see some of you folks coming in and out, or some of the doctors that work with your services. But I, like I said, had talked to Dr. Daly because we were starting to interface with fire and EMS, especially in Schenectady County, and they weren't familiar why we were there. And then when law enforcement was handing the call over to us, I had talked about that maybe it'd be helpful if everybody knew what we were doing and why we were doing it and why we're even ending up on calls with you. So we were supposed to do this about a year ago, but since COVID has, caused havoc in our lives, but also we all got real busy. I circled back around with Dr. Daly, and he quickly got me in touch with Tim. That's kind of my short spiel. I am open to questions, any feedback if you have interfaced with any of my teams. Like I said, more than willing to come in and do any trainings on de-escalation or working with mental health clients. Did actually just speak to one of the chiefs in Troy the other day when he was at the EDPRT. I don't know if he's on this call, but we did talk about that. And so we're really open to partnering and providing as much support we can to all of you. I apologize for anybody that is on here that we don't cover your county. I think I heard somebody say Gloversville, and we don't, but you do have a crisis team there. They're just not as expansive as ours. But again, we do cover the 6 counties. So that's my story.
Well, thank you very much, Jennifer. We look forward to working with you.
You're welcome. If anybody has any questions, they can either email me or I can, or does anybody have any questions before I stop talking?
Yeah, Jennifer, about how long do you usually spend up staying on scene with the patients?
I mean, it depends on the situation and what's going on. I mean, if, so it will be interesting to see how it will work with emergency services, right? Because, each county and jurisdiction kind of gets sent out for different reasons. And so for law enforcement, if we get called out and they are also called out and we get there and the situation is safe and we don't feel like law enforcement needs to stay, then we send them away as long as their department is okay with that. And most of them are. For you all, if you guys are being called because you're looking at just providing medical attention, if there was any need and they don't need to go to the hospital, then we would let you do that and then manage the behavioral health side of the call. If it's a matter of everybody's out there and there's an assessment that needs to happen, it really depends on, again, the needs of the client and also what is going on with them. If it's a suicidal client, it's probably at least minimally 30 to 45 minutes just so us to get enough collateral, but also do our assessment. But sometimes it could be 20 minutes. I mean, because sometimes we can get out there and know right away that we can safety plan or send somebody to the hospital, or sometimes it takes a little bit longer depending on how chaotic the situation is. Was there anybody else?
Any other questions? Jennifer?
Well, thank you for taking the time to listen to me. Like I said, I did send our flyers to Tim. So please, reach out or, make sure the community knows about our service, especially if you're ending up at individuals' homes that doesn't necessarily need to go to the hospital or circling through the hospital that maybe could benefit from our service. Or if you, again, are out on a call and, would like us to come out and support you, we are more than willing to do that. And then, like I said, we do offer trainings. So I appreciate your time. Thank you.
Thank you, Jennifer.
Thank you.
Thank you, Jennifer.
You're welcome. Thank you.
Rob, we probably should officially close academic before you move on to Remac.
That's fine with me.
So do I have a motion to close academic?
Motion.
Thank you. Anybody second it?
Second.
Thanks, Sam. Anybody against? Okay, our next meeting will be in June, which will be the last one before the summer. Okay, over to you, Rob.
Okay. So we'll open up. We are still early for our official start time for her to talk. So this will be definitely a quick meeting for everybody. So can I get a motion to approve the minutes for February? We did actually have a little bit of minutes sent out. Motion?
I'll make the motion.
It's gonna be you and me making all the motions today.
Second, Rob.
Okay.
Second.
Okay, so correspondence, City of Long Beach Fire Department, agency code 2924, assess civil penalty of 2,000 for violations, part 800 and 800.23. Kevin Carnell, Yap Hank, New York number 470842, voluntary surrender for certification effective 3/9/22 for violence of part 800.16. And William Gayard, Hoosick Falls, New York, number 356, was issued a formal reprimand, placed for probation effective 3/17/22 until his current certification expires at the end of 2022, and assessed a penalty of $500 for violation of 800. Don, do you have anything to add from what you said 20 minutes ago?
No, other than the meetings are next week. They will be hybrid, so people can come, I believe, if they want to. They also will be online. And they'll be at the State Plaza.
Okay, thank you. Remsco had the budget reports. I don't think any significant other changes. Did discuss how Tim's having trouble with Mountain Lakes. Arams has been very supportive with any alignment and merger, but Mountain Lakes seems to have disappeared off the radar. So that's kind of what I can remember from Remsco. CMAC and Semsco, we just discussed. Mike's not on. Does anybody have anything for QI?
No meeting today, Rob.
Okay. And no report for the Hawk.
Correct.
Agency updates. No ALS, BLS, or BLS medication upgrades. EPCRs, Wyanskill, the Freesville Fire Department, Lebanon Valley Auto Racing, Palinville Fire Department, Mechanical Fire Department, and Pine Grove Fire Department. Public access, multiple pads, Amazon Company Services, Morgan Stanley, Central Eastern, Livingston Weddings, Congregation Gates of Heaven, Palace Theater, Germantown City School District, Mohonasen City School District, Selwyn Freeman, Dental, been trying to turn it into school district. Henny Reels, South Glens Falls Methodist Church, Martin Van Buren Historic Site, and Department of Veterans Affairs. New business, we just did Atlas Mental Health. The one thing I want to discuss is now that the stroke centers are having to be externally validated either by Joint Commission or some other agency, they're going to be probably a lot more proactive with getting the stroke education done that has to be done. My thought with this is, since most of the hospitals in the area are now primary stroke centers, we have one comprehensive stroke center, rather than having what would amount to 10 different stroke educations at least throughout the course of the year, because each one needs to do it twice, is putting together some sort of a regional program that we can all participate in. This would make it a little bit easier to have a consistent messaging between what appropriate stroke care could be. Also would cut down on how many voices you guys need to listen to, and would streamline the workload for the stroke centers to get this done. Just want to know thoughts on any recommended format to do that, either live in person, something recorded. What do you think the best way to get a message out would be on a routine basis?
I would say recorded, Rob. That way people can do it at their, when it's convenient for them time frame.
Okay.
Trying to get all of us together at the same time is difficult sometimes.
Yeah. And what I'm thinking of is just kind of maybe either have a panel discussions or rotate through which center's doing it which time and all kind of sign off on it. So that we're all not doing it 10 times a year.
I know before COVID happened, the hospitals did come together and put on a pretty nice stroke education night with a dinner and everything else, usually at the Italian American Club. And it was very well attended also. So I know the works and process for our joint effort is already well established, and we can probably just, enhance that.
Okay. So that was new business. I think we'll do is
Excuse me, Rob. Yeah, I think that's a great idea on the stroke education issue. If it's something that can be done live and there's a lot of attendance, great. But if it's something that can be recorded and then accessed by other providers who couldn't make it on that particular night, or just make it all virtual and access it as people can on their own schedule, on their own time. But one way or the other, having access to it on people's own time, if it were recorded in some way, that would be wonderful.
And I'm thinking that maybe it depends on what the stroke center resources would put into it. Maybe one big in-person thing and then one recorded thing a year, and that would get everybody's requirements met.
Yes, but maybe the in-person seminar could also be recorded, so it could be
definitely.
accessed for credit as well,
Yeah, I think with how far we've come, there's no excuse to not have a recorded and remote version for everything now. Any other new business, any old business that we missed? Okay, if anybody has anything they want to bring up for future meetings, just let Tim know, let me know, let Mike know, so we can get it on the agenda. So with that, unless there's any just discussion, motion to close. Okay. Sam, you have a second? So our next meeting is the same in June, last one before the summer. Have a good day, guys. We got a lot of extra time today now.
Okay, thanks, Doc.
Thank you. Good night.